The show, I'm being joined by Dr. Shashank Joshi, endocrinologist, Lilavati Hospital and Padma Shri awardee, and Vishal Manchanda, Senior VP Institutional Research, Systematix shares and stocks, that he will be joining us very shortly. Welcome to the show, Doctor. And so firstly, the Delhi High Court, has refused to stay the order, which is a clear relief for Dr. Reddy's from an investor and industry lens. But I would like to, ask you that this legal, clarity that helps the companies, but on the ground, what really matters is what the patient is accessing. So how do you, view this stay that has come in, on the drug per se?
So currently, people living with diabetes and people living with obesity, they have a lot of options. And India being a very large geography, and we have large pools of type 2 diabetes and obesity living in India, we want affordable access. And anything towards affordable access is a welcome step. Also, both the GLP-1 and GIP-1 manufacturers are trying to make this more and more affordable. Now, the semaglutide is in oral. It is in injectable which is Ozempic for the diabetes, and the Wegovy for the obesity space. And some of these medications next year may go off patent. So we are mindful that in India we have to respect the patent law. At the same time, we want larger access to a larger population because they have some compelling benefits. They actually are anti-complication drugs, particularly the semaglutide injectable version in which there is Ozempic or Wegovy in diabetes type 2 or obesity. They definitely have an impact on heart disease and various other vessel conditions, sleep apnea, and so on and so forth, or the metabolically associated fatty liver disease. So obviously, when there are such compelling indications, we want the most deserving population to get an access to it at the most affordable price without compromising on the quality of the medication. And that is the key. So I think from that standpoint, I welcome Novo Nordisk for making the pricing more affordable with the launch of their injectable version of semaglutide in form of Ozempic for type 2 diabetic population. Their Wegovy is semaglutide for the obese population. And we already have tirzepatide, which is already there in the market. And we already had oral semaglutide in the market for the last 3 years. So I think as the price is a function of volume, the more affordable it will be, the larger volume of people we will be able to give this medication. Remember, this medication is a supervised medication. It has to be given under endocrine or medical care and to the most deserving population.
Okay. And Mr. Vishal, I'd like to come, I'd like you to come in here. So Novo Nordisk is saying that Ozempic is starting at 2,200 rupee per week, and we were, as the doctor also mentioned, that it's priced, quite decently well. So, but the supply is now, uninterrupted. So is this pricing sustainable for scale in India, or does it still restrict the addressable market there?
Yeah. So I think the price has come down with respect to what it was earlier during the, so like if you compare this to Mounjaro, the price is definitely lower. But I think for a larger excess, it has to come down substantially, much lower from where it is today. So I think once generics come in, I would expect at least up 50% lower price tag to this medication.
Okay. And Dr. Shashank, from a clinical standpoint, so does this pricing really influence the prescription decisions in India, especially when therapy often needs to be, continued in the long term?
It does, but as I told you that because the burden of cost in people with diabetes or obesity is in the complications, and that is very big. So compared to that, if you are able to invest an amount for therapy which can reduce complications, it is also cost effective when we do a health economic or a pharmacoeconomic analysis. But definitely a lower pricing allows a larger access. That is very, very clear cut. And as I said, we want the most deserving population where it is indicated with obesity and type 2 diabetes to get an access to these drugs where it is medically indicated or endocrinologically indicated. So I think it is a welcome step.
So it's a welcome step, and that also brings us to how people are actually, using these drugs today. So, Dr. Shashank, GLP-1 drugs are increasingly being used for weight loss because they suppress the appetite. So, medically speaking, where do you draw the line between, appropriate use and misuse? And if it will be available, so how the masses are gonna, use the drug?
So this is not an over-the-counter drug. This is a drug approved by the Drug Control Journal of India, and he has clearly put a label that this has to be only given under prescription of a qualified endocrinologist or a qualified internist. Except those two categories of doctors, no other category of doctor is allowed to prescribe this drug. So even within the medical community, it is a restricted use drug for a population with type 2 diabetes with more than one comorbidity with a BMI more than 27 or just a BMI more than 30. So these drugs are medically supervised drugs. These are not at all over-the-counter drugs. There is no role for microdosing. These are not cosmetic drugs at all. They must be reserved and preserved for the most deserving population so that we can ensure that we can preserve their heart, their liver, their obstructive sleep apnea, their osteoarthritis, and we can get benefits because these are disease modifying drugs. They change the outcome of complications, and a lot of science and outcome science is there. Of course, every drug which has an effect also has side effects. So we need a strong pharmacovigilance and safety profiling of these drugs. And therefore, we start with the lowest dose and go very slow under medical supervision. So I clearly would like to urge that people at large should not take these drugs. They should go to an endocrinologist or an internist and see whether they are eligible for this drug. And please keep these drugs not for cosmetic use, but for medical use.
And doctor, very quickly, like you rightly mentioned that there are side effects also to it. So I would like you to, clarify that for our viewers, that what exactly are those side effects, and if you have personally, used it on some patient, and if you would like to share some anecdote there.
Right. So all these drugs from the GLP-1 axis have a little bit of nausea, vomiting, diarrhea, constipation. We have to rule out gallstones. We have to do a calcitonin test for thyroid nodules and family history of thyroid cancer. We must be mindful of pancreatitis. We should also be mindful of eyesight. So we need pharmacovigilance. And that is why we start with the lowest dose and very gradually up titrate the dose. And we need to ensure that people do muscle strengthening exercises. They preserve their bone and muscle mass. There's appropriate nutritional and lifestyle prescription co-prescribed with these medications. And these are medically supervised.
Okay. And this behavioral shift has big implications for pharma companies as well. So Vishal, I'd like you to come in here. So when you compare a Mounjaro, Ozempic or Wegovy and cheaper options also available like Lilavati, the price gap is stark. So does this open a very clear runway for the Indian biosimilars to gain the market share?
So my sense is pricing. So as we have discussed earlier, volume obviously would be dictated by the pricing that companies set for these drugs. And my understanding is the cost of manufacturing, there is substantial scope for companies to reduce prices from current levels, maybe 60-70% from current levels, but that would entirely depend on how many companies get approval for launching semaglutide in India. So far, what I can see is 3 companies have an approval, but they'll have to wait for the patent expiry, which is around March 26 to launch their copies. And I think we'll have more because about 10 to 15 companies are doing clinical trials for launching a copy of semaglutide in India. So obviously the competition would increase, and we'll see the pricing coming down favorably for patients.
Okay. So let's see if the prices really comes down. And with that, I'm afraid that we are running short of time. But thank you so much, Dr. Joshi and Vishal, for being there with us and sharing your insights on this very crucial development that has come in on the pharma side.